All right, proceed cautiously, too, when it comes to this Zika virus, because a lot of people in this country have assumed, all right, it's happening over there, the odds of it happening over here, low, maybe in Africa, maybe in much of Latin America, not here. It really depends on who you talk to, so we brought the best of the best to sort of pick it apart. Dr. Athony Fauci is the NIAID Director, looks and examines all these threats, what's real, what's not. Doctor, what can you tell us? I mean, when the Institute looks into this, how do you assess the Zika threat right now?
Well, the threat, certainly we're well aware of what's going on in South America, Central America, and the Caribbean. Puerto Rico is really quite vulnerable. It is likely that they will have a major outbreak. They already have, well now in the territories, particularly Puerto Rico, over 475 locally transmitted cases. I think what the American public should understand is the difference between a travel-related case and a local outbreak. We already have over 350 travel-related cases of Zika in the United States, namely people who've gone to South America, the Caribbean, gotten bitten by a mosquito there, got infected, came here, and got sick while they were here. So it's a Zika case in the country, but it's travel-related. What we have not seen thus far is what we call local transmitted cases, where someone may go down to the southern part, Caribbean, South America, got infected, came back, and then a mosquito in the United States bites that person and then bites another person, and then you get what's called local transmission. We would not be surprised, and it is maybe even likely, that we will see some low degree of local transmission of Zika in the United States, particularly in the southeastern part around the Gulf Coast states. And the reason we say that is because historically there have been other similar infections transmitted by exactly the same mosquito, infections called dengue and chikungunya, which have been in that region. And we have, over the past couple of years, seen local outbreaks of dengue in Florida and in Texas, and a local outbreak of chikungunya in Florida. We've been able, fortunately, to contain it and to prevent it from becoming sustained.
But what if you're unaware,
and widespread,
Doctor?
Mostly,
what if you're unaware? You
right.
visited that region, you have it, you come back
right.
home, you've had intercourse. What are the dangers there where it passes along?
Well, first of all, if there is local transmission, it would be detected before it became to the point where we believe it would be a danger for people to even be in that region. You have to understand that the likelihood of there being a disseminated enough outbreak to cause that kind of concern is low. It's not zero.
Right.
And that's the reason why very, very much the CDC is very much on top of this, to monitor this, to see, A, if it happens, and B, if it does, to try and contain it.
Doctor, thank you very, very much. We appreciate that.